Welcome back. Now you can call in. The number to call is 0808 054 2233. It's going to be on your screen, 0808 054 2233. And you can always tweet at CTV_Mary A. While we continue about peptic ulcer. Remember, the topic is peptic ulcer. Your questions should be strictly about peptic ulcer. So, is this something people inherit from their parents?
Peptic ulcer can be inherited in a small percentage of people. So if you have a strong family history of ulcers, yes, there's that likelihood. It is not all the time that it must happen.
Is this because it would be the same integrity of the digestive tract lining that a parent will give his child?
That's a possibility. The other thing is because sometimes there's an association with a certain blood group, which is blood group O. They tend to have higher incidence of particularly duodenal ulcers. So that can happen as well.
Okay, so what are the risk factors for getting a peptic ulcer?
The risk factors will include what we've talked about, the H. pylori, the drugs, and also alcohol. Excessive alcohol intake is a common risk factor. Smoking, tobacco smoking, and smoking generally. And how smoking will do that is by reducing the mucosal defense factor.
What's mucosal defense?
So in the lining of...
Just a minute, there's a caller on the line.
Okay.
Hello, Steve. Steve from
Hello,
Yaba.
good morning.
Good morning, Steve. What's your question?
Yes. Mine is not actually a question. The woman that you are interviewing actually made mention of the certain tests that one has to do, which I think I've done. Of course, I think they inserted something like a pipe, just like the way she described it to you. At the end of the day, I have I think severe ulcer, and the man that said this to me, they said I should go and see my doctor, which I did. So he now prescribed a tablet called Pylorez, which I've been taking for quite a while. And I realized that I'm not still feeling better. So I want to ask a question that, is there a way I can actually repeat the test, then after the test, maybe another tablet or medication that will be more appropriate can be prescribed for me to have a very better relief?
Medication isn't working. Does that happen, and what's the solution to that?
I think what they did for him was an endoscopy, and afterwards they gave him medication to eradicate the Helicobacter pylori. So usually what we do is, after the prescribed number of period, which I suspected he must have used it the way they've actually asked him to do, we do a repeat of the test. Usually the test we do now, because we can't be repeating endoscopy all the time. So
you have to find out whether they've actually gotten rid of
the Helicobacter. So that is easy if you have the urea breath test, or you do a stool analysis for H. pylori antigen to check if it's actually completely eradicated. And also to go through that report again, what did they really find? Was a biopsy done? During endoscopy, people can do tissue biopsy, and there are other things that can come alongside peptic ulcer. Sometimes, depending on the size and the location, it may take some time before the symptoms go away. So you've taken care of the H. pylori, but it has already caused deep-rooted ulcers. So you may need to use some other medication, not the same one, the combination of the three probably that he was given, maybe just one of them. We use a proton pump inhibitor, for example. You may have to use that for a little longer period. But I'm sure the doctor, if you go back to your gastroenterologist, they'll be able to advise him on what to do next.
Okay, so we were talking about an erosion of the mucosal lining. Is this like creating a sore, a wound inside the stomach or the duodenum?
That is what it is. Ulcer is actually a sore in the inner lining of the intestine.
Okay, so you've gotten rid of the H. pylori,
yes,
but you still have this deep sort of crater
that you need to heal.
Okay, and that's what you use the proton pump inhibitor for. What does it do?
It's literally just helps to suppress the acid. You know, what we're saying causes ulcer is an imbalance between the mucosa aggressor, which is the acid majorly, and the defense mechanism. By design, the intestine has mucosa layers, the inner mucosa layers, which secretes mucus, and bicarbonate. Those are the things that help to protect the intestine from the effects of acid.
Okay.
Everyone has acid. So,
is it acid necessary for digestion?
It's necessary for digestion, so it's very important. So we all have that. So in normal circumstances, we have the acid level, and you have that alongside the mucosa defense, and there's no problem. It's when there is a disruption in this balance that there's ulcer formation. So exactly, it's when there is a lot more of these aggressors that then the lining breaks down and sores are formed. That's what an ulcer is about.
Okay, we've spoken a lot about the Helicobacter pylori infection. What about the others? What if it's something that was caused by that's Zollinger-Ellison syndrome you talked about, or it's caused by medication?
Yeah, exactly.
How do you handle those kinds of ulcers?
For all of them, the handling is the same. If it's drug-induced, then you want to confirm there is actually an ulcer that is formed, and of course you stop the drugs. So for those people, we tell them no NSAIDs, that's what we call the non-steroidal anti-inflammatory drugs, ibuprofen, aspirin.
Do they have replacements for those?
There are other drugs that do not have that effect that is available that they use. So we tell them and we warn them. So if you have arthritis, then you should don't use any of those, because those are common drugs that they use for arthritic pain or back pain and menstrual pain, and so you have to look for an alternative. So you tell your doctor, sorry, I have peptic ulcer, can you give me something that will not give this effect? So normally most doctors will ask before they prescribe the drug, do you have ulcers? Do you normally have abdominal pain and all that before they write that? So that's important. For the Zollinger-Ellison, it's not so common, but
let's just hold on a bit on the Zollinger. We've got a call coming in. Hello.
Hello.
Hello. What's your question?
Hello, good day.
Good day. Can we have a question?
Yes, my question is, I just want her to tell us about the commonest ulcer pregnant women complain, or reflux, I don't know.
Okay, thanks. Do you understand what he's talking about?
He said
pregnant women complain of reflux. Is that the same thing as an ulcer?
Reflux is not the same as ulcer. Reflux occurs when there is a backward motion of stomach content into the throat.
Is that common with pregnant women?
That is common with
probably
pregnant women.
Because there's no space in there.
Really, it's because the growing features puts a pressure on the stomach. So it allows food that is already in the stomach to come back up.
So is this one of the things that causes that same sort of pain?
Yes, those are things that appear to be like ulcers, but they are not really ulcers.
All right.
Right. So, sometimes they can occur side by side. So you can have someone having reflux disease and also having presence of ulcers in the stomach or in the duodenum.
So we're talking about the last type of ulcer, the syndrome, Zollinger-Ellison syndrome.
Okay, so for those ones, you need to do some blood tests to check we call the serum gastrin level. So when the report is out, you'd see markedly elevated serum gastrin levels, and the appropriate treatment will be given thereafter.
So all of them can be treated?
They can be managed.
Okay. Somebody told me that she had to have a surgery for her own ulcer. You're going to be telling us why someone has to have a surgery and in what circumstance. But before you do that, we'll go on a really short break again. Okay. Let's take a short break and come back in a minute. Stay with us.